Welcome to a free on-demand webinar presented by Michigan Alliance for Families. We partner with experts from across the state to offer live webinars to help answer the questions we encounter most frequently. Our webinars are recorded and archived for future viewing. Handouts for our webinars can be requested through our webpage, michiganallianceforfamilies.org/webinar. Remember to keep up with Michigan Alliance for Families on social media, and be sure to check out the other videos on our YouTube channel. Follow-up questions to this webinar can be directed to us at info@michiganallianceforfamilies.org. Today's presentation is DeafBlindness Overview and Resources with Beth Kennedy from DB Central. Welcome, Beth.
Thank you. As she said, I am Beth Kennedy, and I am the Director and Educational Consultant for DeafBlind Central, Michigan's Training and Resource Project. We're located at Central Michigan University, but we are a statewide program. In addition to that, I wear the hat of being the director and instructor for the DeafBlind Intervenor training program, which is an online certificate that can be taken through Central Michigan University. So two hats, both about deafblindness. What I'm here to talk to you mostly today is about the DeafBlind Project and how it's a resource for you. So DB Central is kind of our nickname. As I said, the whole name is DeafBlind Central, Michigan's Training and Resource Project. But at DB Central, we're kind of a one-stop shop. So if you're involved with someone who qualifies as deafblind, which I will explain over the course of the PowerPoint, all of these things that we do on the slide here are free of charge to you through a grant from the United States Department of Education. And like Michigan Alliance, we do rely on data for that reason. So as I mentioned, we're a statewide project. We're also year-round, so this is nothing that's tied to the school year. If it's a summer month and you need a resource, you can still reach out to us. We provide training on the local team level so that it's tailored directly to a student's needs, all the way up to statewide training or statewide conferences that are very general about deafblindness. In addition, we provide consultation. So if you are working in a classroom or if your child is placed in a classroom and that team has never worked with a child with your specific support needs, we are a resource to the team. And I don't come in and say, you know, this is exactly what you need to do for this student. I try to take an approach of, I know deafblindness. I've worked in the field of deafblindness for almost 30 years. So I have this store of information that I've accumulated. You, the team, know the student. You, the parent, know the child. How can we have a discussion to come to an agreement about some things we might try in order to tweak what's happening in the classroom or what's happening in the home to better support that person? So that's the approach. Then I also do a lot of information and referral. As I said, we like to think of DB Central as a one-stop shop. So people are calling us because they have some question about deafblindness, but sometimes it does not fit into the parameters of what we do at DB Central. And I don't just say sorry and hang up the phone or delete the email. We actively engage in a process to try to find a resource that will address that question or concern. So what I didn't mention is we're birth through 26. So if someone calls us about a grandparent who now has a vision and hearing loss, that's not something we can address, but we're going to try to find something for you. Then we also do systems change kinds of things, because while we're doing lots of child and team specific support, specific family support, we're also saying, how can we change the big umbrella to better suit our population? And we maintain a census. Some of you might have received our census information or packet, and we appreciate those updates each year because the census enables us to reach out to specific teachers and to specific parents and say, hey, we understand you have someone who qualifies. Here's what we can do. Please lean on us. We can help you. And the other reason the census is important is that when people are reported to Michigan Department of Ed with their educational label, not many students who are deafblind actually have the deafblind educational label. A lot have SXI, some have AI, you name it. We have students with pretty much every educational label on our census. But when we talk about deafblindness in Michigan, we need to know about all the kids who don't have the deafblind label. We have right now about 28 students who have the label versus there are over 300 students listed on our project census. So you can see the difference there and how it would make a huge difference in terms of policy and programming. So in order to receive our services, you have to have someone who's deafblind. I can't devote any grant funds to come out and help and do a training unless there might be someone who's deafblind in your pool that you're trying to serve. If you're a family, we can only help you if your student qualifies for our services. So if you call us and you don't have someone registered, we'll check to see if you have someone who's eligible and get that person registered. If you don't, then again, we'll try to refer you to someone who can help you. And then we do very specific consultation tailored to your family's needs. And if we're helping the school, then we're going to need the family to sign a consent form that says that we can discuss this child or this student with the team. And then you can request support accurately identifying people, as I kind of alluded to. So this deafblind label that I mentioned earlier, there is a federal definition of deafblindness, and this is in IDEA. And as many of you know, IDEA has been around a long time, and it's up for reauthorization and has been for a long time. So this definition, we in the field feel that it's getting kind of old and we're ready for it to be updated. But as it stands, it simply says that deafblindness is someone who has a vision loss and a hearing loss, and those needs can't really be met in programs for deaf or for blind. And you can see, if you know about the Michigan educational system, you know we have a school for the deaf. We don't have a school for the blind. And that is the same in many states, and some states don't even have schools for the deaf. So we've got to get this definition updated. In Michigan, we have gone further, as some states have, to say that, okay, that's the federal definition, but in Michigan, we're going to do even better. So I got to be on the planning committee that developed this definition. So I'm grateful for that. And what it says is kind of, the wording sort of follows the federal definition at first, but then it says it can't be accommodated in special education programs without additional support unique to people who are deafblind. So we tweaked that away from the language that was getting outdated in the federal definition to reflect something that's current and probably won't become dated. But we went further and said the documented hearing and vision losses, if you consider them separately, they might not qualify you for the services of a vision consultant or the services of a teacher of the deaf and hard of hearing. But because those losses happen together, they have a significant educational impact, and we need to address those. So we can capture kids that might not be able to, meet special education requirements of other labels using that A section. The definition does go on to say that you can also qualify if you cannot process auditory and visual information given your intellectual level. So for students who you can't send them to the audiologist or a low vision clinic or ophthalmologist and get accurate testing because they have multiple disabilities. So if the team around that person says, we think they qualify because they function as if they have hearing and vision losses, then they can qualify as deafblind. And then 2 goes on to list out just a huge list of people who could be qualified to make a determination on deafblindness. Includes educational staff as well as clinical staff, medical staff, virtually anyone. So I'm here today because deafblindness is a disability of access. If you have a vision loss and a hearing loss, you do not access your environment or your educational program in the same way that hearing sighted people do, or even someone who has one loss or the other. And that's why it matters. You don't have access. So all the bells and whistles, all of the efforts that the school is making, that the family is trying to implement, if you don't take into consideration the needs of the person who's deafblind and make those accommodations for vision loss and hearing loss and concept development, then all of those things that you're doing can be minimized. They won't have the impact that they could if you had the right supports in place. So if you walk away from this webinar just knowing this one thing on this slide, I will have succeeded. But deafblindness is not just deaf plus blind. When especially you are born with deafblindness, there's a greater impact on every stage of development. Even those who become deafblind later, as they start to live as someone who qualifies as deafblind, that lack of access is bigger than just vision loss plus hearing loss. So to explain this a little better, this chart was developed in 2001, so it's getting old, but it's kind of one of those oldies but goodies. And what you can see on the chart is that we get a huge chunk, almost 70% of our information from our vision. Then it drops to about 20% for hearing, then touch, then smell, then taste, right? But if we think about this, almost 70% vision, almost 20% hearing, if you add those together, 90%, that's tremendous. Now, it is rare to be totally deaf and totally blind. Most people who are listed on our census have some level of vision loss, some level of vision and hearing loss, and then have additional disabilities. So this is just sensory information, and it's just the 5 senses. I mean, people also talk about the vestibular sense and the proprioceptive sense, balance, and knowing where your body is in space. So this is just multiplicative, right? When you start to think about all of these factors and how it impacts how someone can interact with other people in their environment. That's why the United States Department of Education continues to fund grants like DeafBlind Central, because it sort of stumps the team and families need resources and supports. So a little bit more up to date, Linda Alsop from Utah State University developed this handy graphic. And It's a pyramid, and what you see is that someone who is a typical learner, so is hearing and sighted, most of the information that they learn happens instantaneously in a snap without even thinking about it, right? You walk into a room, you glance at your computer screen, you take in so much information without anyone giving it directly to you. It just happens. And then you see that second layer of the pyramid, a little bit smaller, and that's what's happening right now. You're sitting and taking in this information that I'm giving to you. That's what happens in a classroom or a college auditorium, just sitting there taking in the information. Now that direct piece, most of us don't get a whole lot of direct instruction. Some things you might be able to relate to. If you're learning to drive, chances are you were taught directly, right? Your parent rode around with you in the car, just you and them, teaching you how to be safe. Then the driver's ed coach probably did the same thing. It was very direct instruction because you're operating a vehicle, you need to be safe. If you've operated heavy equipment at work, you have that same kind of direct instructional need, because if someone just said, just watch me and then figure it out, you could really get hurt or hurt someone else. So here's what Linda Alsop hypothesizes that learning might look like for kids who are deafblind. So that huge place that was incidental for typical learners becomes the tiniest part. Because if you have a vision loss and a hearing loss and additional disabilities, you aren't going to be able to just quickly scan the environment and take in as much information. That secondary piece where I said you can sit in school and just learn from someone providing a lecture or a presentation, that can also be difficult because of the level of access and the language barriers and the concept development. And now for someone who's deafblind, that huge piece is direct learning. They need to have hands-on experience in order to really appreciate the information that you're sharing. Okay, so if you are deafblind, here are some areas that are impacted and why we need more direct instruction. So, anticipation. What's going to happen? If you think about it, a typical kid in school is constantly scanning the room to see what their classmates are doing. If people start to line up at the door, they might head over there, or if they can start to smell what's for lunch, or they see someone with a tray with snacks on them or whatever, that's all kind of incidental information that allows them to anticipate what's about to happen. But someone who's deafblind might miss some or all of those cues that other kids get. So sometimes they don't have that same motivation level, which is the next bullet. They're not as excited to what's coming up because they're missing the cues. So even the motivation to kind of socially engage or to engage in the instruction or what's going on at home with the family and all those activities, if they're missing out on the cues, they're not going to be as motivated and drawn to that. And then communication is one of the more obvious ones. And communication is divided into how you express yourself. I'm expressing myself now with speech, and you're receiving information either auditorily with your ears or by reading the captioning or a combination. So communication is impacted by deafblindness, and some kids learn sign, some use tactile sign, some use captioning, some use pictures or objects or even behavior. Some use a combination of these things. And DB Central can come and help the team and the family make some decisions about avenues to take with communication. Of course, there's also print and braille, so it's just a huge gamut. Then we have confirmation. Now that is reassurance. That is kind of the clap that you get from an audience after you do a presentation, or you get a gold star on the chart for doing the right thing in the classroom, or mom and dad take you out for an ice cream because you had great behavior. So it confirms you did the right thing. But we also have confirmation, meaning your impact on the environment. So to stick to a school kind of situation, if someone who's deafblind is walking down the hallway and we have kids and backpacks and things just all over the place, maybe even some adaptive equipment from students who have special needs, and the person who's deafblind bumps into someone who bumps into someone, and water spills and a backpack gets wet, all of that chain of events could be missed by the person who's deafblind. So they don't have the confirmation of what happened. It can also happen with positive things. Like, let's say the child who's deafblind is at home and they're doing something and people in the room think it's so cute and they kind of giggle and laugh, and the child who's deafblind might not realize that they just made everyone's day. They just brought smiles to everyone's face because they don't see or hear that. So we've got to find ways to address all four of these factors for kids who are deafblind, whether that's home or school. So further complicating this whole deafblind thing, as if it's not already complicated enough, we've got a tiny population, right? In Michigan, I said around 300 for several years. We've kind of fluctuated, maybe gotten as high as 350, 330, but we've stayed pretty much above 300 and haven't maxed out over 300 yet, or 350 yet. So even with that tiny slice, we have huge diversity. And it's because age of onset, right? I said some people are born deafblind, whereas some people become deafblind. And of course, that impacts your language development and all of the things that you learn through incidental learning and all of the things that we've already talked about in this PowerPoint. And then you have the degree and type of vision loss. Maybe you had a lot of great usable vision and it's gotten worse over time. Or maybe you were born with a significant loss that's very stable, but it's pretty significant. So all of that variability. Hearing goes the same way. You might have been born hearing and lost it. You might be born profoundly deaf, so you've not heard much of anything from birth. So is your vision and hearing loss significant or mild? Is it stable or does it get worse? And then the educational intervention. I wish I could say that all kids receive equal early intervention and they all have the best of educational teams and we're all good. But if that were true, we wouldn't have things like Michigan Alliance for Families and DB Central. So the educational intervention that's received does have an impact on development. And so we need to make sure that we have the best educational intervention possible. And then the family situation. Do we have a whole family unit, or do we have partners that are separated? And so the child spends time in 2 different or more households. Are we with immediate family or extended family? That kind of thing. Is it an only child? Is it a child of many siblings? And then the socioeconomic background. Of course, I wish that all things were created equal, but they're not. And so we have some people who are living paycheck to paycheck. And then we have people who have a lot of extra and are able to buy things and have greater access to vacations and different experiences. And all of these things, each of these 6 bullets, causes this huge diversity within a tiny, tiny population. So, talking more about that educational piece for kids who are deafblind. Some kids have intervenors. An intervenor is something that's quite new in the United States, but it's been around a long time in Canada. The Canadians have this model, and there's even governmental funding for that. In the United States, we're not so lucky yet to have governmental funding, and it's not in federal law. Some states have adopted intervenor policy or their special ed rules. Deafblindness is included, and so are intervenors. In Michigan, we have the deafblind label, but we do not yet have intervenor included in MARS. So there are teams in Michigan that are offering intervenors for kids who are deafblind, but it's through some parent advocacy and just ed teams wanting to try to see what this support is and how it might work for students who are deafblind. And on the DB Central website, which is dbcentral.org, you can click around and there's a map that shows where in the state we have intervenors working. So I've gone on quite a bit without even explaining what an intervenor really is. An intervenor, according to the National Center on Deafblindness, is someone who has specific training in deafblindness, not vision loss and hearing loss, not special education, but deafblindness. And so they understand the impact and the development and the communication and how to make social connections for kids who are deafblind. And I will talk more about how you become an intervenor and how you learn this. But what does it look like when you have an intervenor on a team? So intervenors work with teachers. They are not teachers. At best, an intervenor has a certificate, not a full degree. And so is more like a paraprofessional on the team, not a professional. And intervenors work with the teacher. They work with the therapist and ancillary staff in order to say, listen, you have your specialty area, I have my specialty area, let's work together. Because the intervenor, because they're with the student and have developed a trusted relationship, a real bond with them, they're able to get a student to do more than someone who kind of pops in and out. You know, a speech language pathologist has their own caseload and they have multiple students that they need to see. Same with vision consultants, hearing consultants, OTs and PTs. And an intervenor is with the student all the time. So the OT can come in and they work together with the student, which gives the intervenor some training and ability to do some of that implementation. So instead of a child who's deafblind just getting OT 20 minutes twice a week, those strategies are implemented throughout the week all day. And so when you have an intervenor on the team working with the professionals, your implementation goes way up. And then guess what? So does your present level of performance for the student. Educational goals are being met, success is being experienced by the teacher and the professionals on the team. The family feels good because the child is making progress. And so it's kind of win-win when you have a trained intervenor, and that's the key, the training. So intervenors also help out during assessments to make sure that assessments are adapted and accessible to kids who are deafblind. Because if the assessment or the person conducting the assessment doesn't understand deafblindness, so doesn't make the test accessible, those results are not accurate. and educational decisions can be made that might not be the best. And so when you have someone who has intimate knowledge of the child and can make accommodations, then that assessment's going to be more accurate. And then the decisions that are subsequently made will be better for the student. Intervenors should also be part of team meetings. Some schools are better at that than others. Sometimes the teacher just wants to get information from the intervenor and then the teacher attends the meeting. But ideally, the intervenor will be part of the discussion and brainstorming that happens at meetings. And that helps them to have connections with the people on the team, the family, and as well as all of those professionals. And then intervenors and intervention are new concepts. And so sometimes there's a little struggle on the team to kind of figure out everyone's role and not stepping on each other's toes and all of that. Now, there is a national credential for intervenors. So I mentioned that there's training. There's intervenor coursework at 2 colleges and universities in the United States, which is not a lot, but we're ahead of legislation. And so these 2 higher ed programs can meet the need so far. One is at Utah State University, and one, as I mentioned at the start, is at Central Michigan University. Both programs are online and can be taken by anyone in the United States or really anyone in the world. It's all online. It also, this national credential involves a practicum experience. So you're getting the knowledge from the higher ed program and you're getting skills practice working with the student who's deafblind. And as you are going and getting this knowledge and this skill, you're also working with a coach. Someone like me who's been in the field a long time. Someone from another state might work with their deafblind project. But the idea of coaching is really a critical piece of training because it really ups the ante for implementation of what is learned. So at Utah and at CMU, you complete an intervenor portfolio, and it's based on the Council for Exceptional Children competencies for intervenors. And that's kind of the benchmark. What skills do you need to be an intervenor? What knowledge do you need to know to be an intervenor? Prove to me that you have those. So you get a certificate when you graduate higher ed that shows that you have the knowledge, and then your portfolio with all the pictures and little video clips and things, that demonstrates that you have the skills to be an intervenor. And it goes to the National Center for Paraeducators, National Resource Center for Paraeducators. There is a processing fee, but that portfolio is what demonstrates that you have what it takes to be a nationally credentialed intervenor. And there's more about that on NRC Para's website, which is right there on the slide. So, intervenors are not federally mandated, as I said. Some states have passed legislation or policy. So some states have, when you have a student who's deafblind as part of their IEP discussion, they're talking about intervenors by law. Michigan, we don't have that, yet we do have several intermediate school districts that are hiring intervenors, and it's catching on slowly but surely. It's a grassroots effort. But what people are seeing is when they try it, it works. And that's good news for the student who's deafblind, because that's really what we're talking about here. And then for teams considering whether or not an intervenor would be appropriate, there is a tool from the National Center on Deafblindness called the IEP Discussion Guide. And it's on the DB Central website. It's also on the National Center website. And it's a PDF, you can print it out. And the team looks at level of access across all environments, all school environments, community environments. Who's providing that access? How sustainable is it when those people provide that access? How much turnover is there in the staff that provide the access? All these things are discussed through this step-by-step guide. And then the IEP team decides, maybe we should try an intervener, or maybe we don't need to. Maybe the needs are being met by the people we have. And then we have a memo from the United States Department of Education regarding interveners, because administrators like to know how we're going to pay for this staff, because there's no MARS rule. So how can you get reimbursed for that service? And the United States Department of Ed in this memo says IDEA doesn't explicitly state intervener, but IDEA funding can be used to cover intervener expenses. That memo is on the DB Central website. It also is on the National Center website, so you can find it. Ruth Ryder is the person who signed off, so you could probably also Google it. And then we have a National Intervenor Association, or NIA, and that's a group of people. They're just an e-board right now, but they're trying to, it's a group of, I think, 5 or 6 nationally credentialed interveners. It also includes me from Central Michigan University and Linda Alsop from Utah State University. And we are trying to develop this infant group to expand it to be a big national organization for all people who've achieved the national credential. Now, intervener versus intervention. An intervener is a person. An intervention is a service or a practice. And the reality is, even when you hire an intervener, it's still on the team to know how to meet the needs of someone who's deafblind, because intervener is a practice, intervention is a practice, and everyone should be able to implement those skills. So when the intervener is working with the student to make sure they have access in the classroom, and then maybe the speech language pathologist comes in and has some direct interaction with the student, which should happen for sure, then that person should know the strategies, the intervention strategies, so that they can have high quality interactions directly. And interveners are sometimes out sick, and so other people on the team can step in. Why? Because they've taken the time to understand deafblindness and the supports that are needed. And some people will say, interveners one-on-one causes dependency. And really what causes the dependency is the lack of training. So when you're a trained intervener, a credentialed intervener, you know how to provide information and access, and the student becomes dependent on that. So our colleagues in Canada who've been doing this a long time will say, if you take 2 interveners that have the same skill set, they're pretty much interchangeable. But if you take a skilled, credentialed intervener and you sub someone who maybe is just starting an intervener program or has no training, you will see a problem. There might be some behaviors, or there might be some withdrawal on the part of the student, because they don't have the same information and access. And I won't play it for you today because we just have a short time for this webinar. But if you're interested in learning more about intervention and you kind of want to see an intervener at work, if you Google Jarvis goes to the drum store, which is in that last bullet, you will see a 12-minute little clip. It's like a YouTube thing. And Jarvis is deafblind. He's totally blind and hard of hearing. And he has 3 different people support him before he goes to the drum store, at the drum store, and then after the drum store. So 3 people in those 3 segments, they all provide intervention. They all support him using the strategies that he needs. And so you can kind of see the magic of it when people are trained and know how to provide the supports. Definitely worth your 12 minutes. Then I wanted to just show you that there are other resources. DB Central is your Michigan DeafBlind project, but there are other supports in the field. The National Center on Deafblindness has an amazing website. They're kind of an information clearinghouse on deafblindness. And let's say you're in Michigan and you're going to move out of state. You can go on that website and find the contact information for other state deafblind projects. Or maybe, you know, you have a family member or a friend in another state and they need support too. National Center on Deafblind website is a great place to find that information. They've got resources for families, they've got resources for professionals. It's really just a great, really rich source of information. And then we have ICANN Connect, which is a federal program, but Michigan has a chunk of money associated specifically for our state through ICANN Connect. It was a program implemented by the Obama administration through the FCC, and he met with a group of young adults who are deafblind, and they advocated for this, and they helped him to understand that deafblindness is isolating. And so the FCC came up with this pot of money that you can apply to get things like iPhones, laptops, desktops, all kinds of technology to help people feel connected, even if they you know, can't drive or can't get to social events and family things readily on their own. They can apply for this equipment, and families can help and support. And it really covers the gamut of people who are deafblind. So if you have a child who's deafblind with multiple disabilities, who's communicating using pictures, you can access this program. Maybe an iPad, so that they can FaceTime with a family member in another state. And even if it's just smiling at each other and laughing or showing each other some pictures on the screen or objects, it's possible to get funding through ICANN Connect. So definitely check it out. There is an income requirement, but the bar is very high. We've had a lot of families, moms and dads, two partners both working, and they've been able to access the program. So it's not like only for people who have a financial struggle. Then there's also Helen Keller National Center, and that's more kind of voc rehab or for transition age. And they do have some training that they do right at the center, but they also have job development that they're starting to do regionally. So I look forward to kind of seeing how that unfolds in Michigan, and that will be through Bureau of Services for Blind Persons, kind of a conjunction working together to get more people into jobs and feeling good about their job skill development. And then there's National Family Association for Deafblind, and that's, as the name implies, a national group. It's a family group. They do some events, they have information, they have regional supports for families, and they do some advocacy on the national level too. So definitely worth checking out, and you can sign up for their e-newsletter and all kinds of good things. Definitely worth checking out if you're a family supporting someone who's deafblind. And then as we wrap up and leave some time for questions, I wanted to share my contact information. Actually, this is the contact information for the project. So it's the general project website. So if you send an email to that address, it will be sent to the right person on the project to tackle that for you. And then that phone number is also our general number. When you call it, 989-774-2725, you will get a phone tree. So then you can select the person you want to talk to. And if you happen to press the wrong person, we will help you get directed to the person on the project who can best address your concern. We're a small staff of just I'm the only full-time person, and then we have some part-time people. So chances are you'll talk to me, but I might hand you off to someone who has a different area of expertise than I do. We do have a family engagement coordinator, so a lot of families end up talking to her. Her name is Kristen Knight. And then there's our website, www.dbcentral.org. The resources I've referred to during this PowerPoint are all on our website. We've just revamped it, so if you visited some time ago, we have a pretty new and exciting website with a scroller and all kinds of updated information, and check it out. And if you have any questions or concerns, please don't hesitate to give us a call. Like I said, we can help you determine if someone qualifies, and if we're not the right place for you as a family or a professional, we will help you find the resource that can address your concern. So thanks very much, and I want to take some time if anyone has any questions.
Thank you, Beth.
You're welcome.
Can you scroll through to those last couple slides? Thank you. Michigan Alliance for Families is an IDEA grant-funded initiative of Michigan Department of Education, Office of Special Education, and we're Michigan's federally funded Parent Training and Information Center, supported by the U.S. Department of Education, Office of Special Education Programs. Follow-up questions to this webinar can be directed to us at info@michiganallianceforfamilies.org or call our 800 number, 1-800-552-4821. Thank you.